Medical Director of the Mauna Kea Malama Integrative Clinic. And Dr. Z, always good to see you. Thanks for being here. Now, this month in the Hawaii Medical Journal, your clinic published the results of a 3-year pilot study about treating patients suffering from severe chronic pain and depression. Well, first of all, what can you tell us about chronic pain?
Well, chronic pain can be one of the most difficult problems people face. It's physically draining, emotionally draining, and can be very isolating. You know, it can be hard to continue our professional relationships, our personal relationships, and even the strongest of us sometimes can succumb to financial ruin, social isolation, and major depression.
So how did your study deal with chronic pain?
Well, HMSA, at the request of HMSA, we contracted to do a pilot study, and we took groups of up to 10 for a 12-week program. They received all the services together as a group. Every week they had acupuncture, psychotherapy, meditation, therapeutic movement. They also had some exposure to Ho'oponopono with the
So a
native
lot of
one.
non-traditional forms of medicine.
Sure.
There.
I mean, it was a combination of traditional and non-traditional. We also monitored medications and so on. It was really an integrative approach.
And so what were the results?
Well, we found that people were getting back to work, that they felt better, and also that they were able to reduce their use of heavy opiate medications. The other thing we found is that a year later, they continued to improve, particularly with respect to anxiety and depression, which made us think that, you know, the patients in the program got the tools to really take care of themselves and continue to improve independently. When they told us, you know, now I feel free, we felt like we got the job done.
So was it the combination of these non-traditional and traditional approaches? Was that the real gist of the study, to see how those would combine with traditional?
That's a great question. It was partly the integration of the services. It was partly the group working together, the patients taking care of each other, and it was also the coordination of care among these different providers that I think created those outcomes.
Is this going to lead to changes to the way at least HMSA does things?
Well, I think that, you know, we saw HMSA's numbers today. I think that we all learned a lot about how we can inform care and manage care moving forward. There's a lot of ways to go at this point.
All right, Dr. Z, thanks so much for being here.
Dan.
Really appreciate it.